Hello everyone. Today, in the subject of medical microbiology, we are going to study about the disease named as influenza. So, the main objective of this lecture today is that to make you fully understand the disease of influenza, what type of infection it causes, what type of random situation it can cause. The outcome would be that we'll be able to understand what is the scenario of viral infection and how they uh, can cause many contagious type of pandemics in the human populations in every country around the world. So, influenza is commonly called as the flu. It's an infectious disease caused by influenza virus. Symptoms range from mild to severe and often include fever, runny nose, sore throat, muscle pain, headache, coughing, and fatigue. These symptoms typically begin from 1 to 4 days after the exposure to the virus and last for about 2 to 8 days substantially. Diarrhea and vomiting can occur, particularly in children. Influenza may progress to pneumonia, which can be caused by primarily viral function infections and by secondary bacterial infections. Other complications of infection include acute respiratory distress syndrome, meningitis, encephalitis, and worsening of pre-existing health problems such as asthma and cardiovascular disease. In this image, you can see the magnified version of influenza virus image, approximately 100,000 times more. Etymology from Italian influenza literally means influence. From Latin influentia, influence, derived from earlier inflore, to flow in, from in into the flore to flow in. A very contagious virus disease with fever, exhaustion, severe aches and pain, and inflammation of the respiratory tract. Influenza earned its name from an Italian folk word that attributed to colds, coughs, and fevers to the influenza of the stars. Later, the term evolved into influenza del freddo, influenza of the cold, or influence of the cold. Here you can see the image of influenza virus and how it affects your upper respiratory tract and your lower respiratory system. So, influenza viral infections that attacks your respiratory system, your nose, throat, and lungs. Influenza is commonly called the flu, but it is not the same as stomach flu. Viruses that cause diarrhea and vomiting. For most people, the flu resolves on its own, but sometimes influenza and its complications can be deadly. People at higher risk of developing flu complications include young children under age 5, especially those under 6 months of age, adults over than age of 65 years, residents of nursing home and other long-term care facilities, pregnant women and women up to 2 weeks after giving birth, people with weakened immune systems, Native Americans, people who have chronic illnesses such as asthma, heart disease, kidney disease, liver disease, and diabetes. People who have a very obese with a body mass index BMI of 40 or higher. So the annual influenza vaccine isn't 100% effective. It is still your best defense against the flu. Coming on to the signs and symptoms. Seasonal influenza is characterized by a sudden onset of fever, cough that is usually dry, headache, muscle and joint pain, severely feeling unwell, sore throat, and a runny nose. The cough can be severe and can last 2 or more weeks. Most people recover from fever and other symptoms within a week without requiring medical attention. But influenza can cause severe illness or death, especially in people at high risk. Illness range from mild to severe and sometimes even death. Hospitalization and death occurs mainly among high risk groups. The effects of seasonal influenza epidemics in developing countries are not fully known, but research estimates that 99% of deaths in children under age 5 with influenza-related lower respiratory tract infections are found in developing countries. Worldwide, these annual epidemics are estimated to result in about 3 to 5 million cases of severe illness and about 290,000 and 650,000 respiratory deaths. In industrialized countries, most deaths associated with influenza occur among people of age 65 or older. Epidemics can result in high levels of workers, school absenteeism, and productivity losses. So, if you take the case of developing countries, such outbreak of influenza can be very lethal to their economy. Clinics and hospitals can be overwhelmed during the peak illness periods. Symptoms. At first, the flu may seem like a common cold with a runny nose, sneezing, and sore throat, but colds usually develop slowly, whereas the flu tends to come on suddenly. And although a cold can be a bother, you usually feel much worse with the flu. So the things they might look very similar if you take flu and common cold, but the influenza symptoms are very much different from others. Common signs and symptoms of flu include fever, aching muscles, chills and sweats, headache, dry and persistent cough, shortness of breath, tiredness and weakness, runny or stuffy nose, sore throat, eye pain, vomiting and diarrhea, but this is the more common symptom in children than in adults when it comes to diarrhea. Epidemiology. All age groups can be affected, but there are groups that are more at risk than others. People at greater risk of severe diseases or complications when infected are pregnant women, children under the age of 59 months, elderly individuals with chronic medical conditions such as chronic cardiac, pulmonary, renal, metabolic, neurodevelopmental, liver, or hematologic diseases, and individuals with immunosuppressive conditions like HIV/AIDS. Healthcare workers are at greater risk of acquiring influenza virus infection due to their hospital environment, which makes them more vulnerable. In terms of transmission, seasonal influenza spreads easily with rapid transmission in crowded areas, including schools and nursing homes. When an infected person coughs or sneezes, the droplets containing viruses, infectious droplets, are dispersed into the air and can spread up to 1 meter. And infected persons in close proximity who breathe these droplets in. So, if you are breathing in such atmosphere, then you will easily catch influenza infection. The virus can also spread by hands contaminated with influenza virus. To prevent transmission, people should cover their mouth and nose with a tissue when coughing and wash their hands regularly. In temperate climates, seasonal epidemics occurs mainly during winters, while in tropical regions, influenza may occur throughout the year, causing outbreaks more irregularly. The time of infection to illness, known as incubation period, is about 2 days, but it also ranges from 1 to 4 days time. What are different types of flu? There are three types of flu viruses: A, B, and C. Type A and B causes the annual influenza epidemics that have up to 20% of the population sniffling, aching, coughing, and running high fevers. Type C also causes flu. However, type C flu symptoms are much less severe. The flu is linked to between 3,000 and 49,000 deaths and 200,000 hospitalizations each year in the country of the United States. The seasonal flu vaccine was created uh, to try to avert these epidemics. Here in the picture, you can see that individual is coughing and droplets that contain influenza virus are coming out. So that is why you should always maintain the distance of 6 feet from an individual and wear mask and use tissue papers. And always keep your hands clean. So influenza, the flu virus from the family of Orthomyxoviridae, common infectious disease. They have different types, type A, B, and C. D mainly affects animals and it is very different. So type A and type B influenza have 8 RNA segments and type C has 7 RNA segments. What is type A flu virus? Type A flu or influenza A viruses are capable of infecting animals, although it is more common for people to suffer the uh, symptoms associated with the type of flu. Wild birds commonly act as hosts for this flu virus. Type A flu virus is constantly changing and is generally responsible for the large flu epidemics. The influenza A2 virus and other variants of influenza is spread by people who are already infected. Most common flu host spots are those surfaces that an infected person has touched and wounds where they have been recently, especially areas where they have been sneezing. What is type B flu virus? Uh, Unlike type A flu virus, type B flu virus is found only in humans. Type B flu may cause a less severe reaction than type A flu virus, but occasionally B flu can still be extremely harmful. Influenza type B viruses are not classified by subtype and do not cause pandemics. How is type C flu virus is different from the others? Influenza C viruses are also found in people. They are, however, milder than either type A or type B. People generally do not have become very ill from the influenza type C virus. Type C flu viruses do not cause epidemics. The pathogen. There are four types of seasonal influenza viruses, type A, B, C, and D. Influenza A and B viruses circulate and cause seasonal epidemics of disease. Influenza A is further classified into subtypes that are also very lethal. Influenza B virus are not classified into subtypes but can be broken down into lineages. Currently circulating influenza B virus belongs to either B. Yamagata or B. Victoria lineage. Influenza C is detected less frequently and is usually causes mild infection, thus does not represent public health importance. Influenza D virus primarily affect cattle and are not known to infect or cause illness in people commonly. Causes: influenza viruses travel through the air in droplets when someone with the infected infection coughs or sneezes or talks. You can inhale the droplets directly or you can pick up the germs from an object, such as telephone or computer keyboard, causing secondary infection, and then transfer them to your eyes, nose, or mouth. People with the virus are likely uh, contagious from about a day before symptoms appear until about 5 days after they start. Children and people with weakened immune system may be contagious for slightly longer time. Influenza viruses are constantly changing with new strains appearing regularly. If you have had influenza in the past, your body has already made antibodies to fight that specific strain of virus. If future influenza virus are similar to those you have encountered before, either by having the disease or by getting vaccinated, those antibodies may prevent infection or lessen its severity, but antibodies levels may decline over time. Also, antibodies against the influenza virus you have encountered in the past may not protect you from new influenza strain that has suffered some kind of mutation and can be very different from other viruses that you have encountered before. So, how to protect yourself from infections? Always wear mask, avoid contacting or staying close to patient who has fever, cough, a runny nose, and Belgium. Always wash your hands with soap and clean water, especially when contacting patients or items surrounding the patient site. When you have fever, cough, and runny nose, please use towel, tissue paper to cover your nose, especially when you are sneezing and coughing. Coming on to the diagnosis, the majority of cases of human influenza are clinically diagnosed. However, during periods of low influenza activity, the outside of epidemic situations and the infections of respiratory viruses, for example, rhinoviruses, respiratory syncytial virus, parainfluenza, and adenovirus can also present influenza-like illness, which makes the clinical differentiation of influenza from other pathogens really very difficult. Collection of appropriate respiratory samples and the applications of a laboratory diagnostic test is required to establish a definitive diagnosis. Proper collection and storage of and transport of respiratory specimen is essential. First step for laboratory detection of influenza virus infections, laboratory confirmation of influenza virus from throat, nasal, and nasopharyngeal secretions. The tracheal aspirate or washing is commonly performed using direct antigen detection. Virus isolation or detection of influenza-specific RNA by reverse transcriptase polymerase chain reaction or RT-PCR test. Various guidance on the laboratory technique is established by the and updated by WHO. Rapid influenza diagnostic test kit has already been developed that work in combination with RT-PCR technique. For flu prevention tips, get vaccinated, Getting vaccinated every year is best protection against the flu. Wash your hands, keep the surfaces clean, avoid touching your face, smile, keep your immune system happy, eat right, a balanced diet, exercise normally, and stay at home, avoiding contact with other individuals as far as possible. Risk factors factors that may increase your risk of developing flu or its complications include age. Seasonal flu influenza tends to target young children of less than 5 years old and adults that have aged more than 55 years old. Living or working conditions, people who live and work in facilities with many other residents, such as nursing homes or military barracks, or are more likely to develop the flu. People who are staying in the hospitals are also at high risk. Weakened immune system, cancer treatments, anti-rejection drugs, long-term uh, use of steroids, organ transplant, blood cancer, or HIV/AIDS can also weaken your immune system. This makes it easier for you to catch the flu and may also increase your risk of developing complications. Chronic illnesses, chronic conditions including lung disease such as asthma, diabetes, heart disease, nervous system disease, metabolic disorders, or an airy abnormality, kidney, liver, or blood disease may increase your risk of influenza complications. Native Americans are also very much prone to catching such infections. Aspirin use under age 19, people who are younger than 19 years of age and receiving long-term aspirin therapy are at risk of developing Ray's syndrome if infected with influenza. Pregnancy people are more likely to develop influenza complications, particularly in the second and third trimester. Women are more likely to develop influenza-related complications up to 2 weeks after delivery of babies. Complications might include symptoms of pneumonia, bronchitis, stomach can also flare up, heart problems, rare infections, acute respiratory distress syndrome, pneumonia-like conditions. For prevention, get yourself vaccinated, and most of the time, the situation, the symptoms, they are very much similar to COVID-19 symptoms. So you should probably be educated and always stay at distance from other people. Take proper medications. Each year, a seasonal flu vaccine provides protection from the three or four influenza viruses that are expected to be most common during the year's flu season. This year, the vaccine will be available as injection as and as nasal spray. Recent years, spray vaccine have been effective, so they are much more in trend. Okay, so if you have allergy, then you should go for vaccination. So controlling the spread of infection, influenza vaccine might not be that much effective, but it can protect you to some extent. Always wash your hands, adapt very good hygiene practices, avoid touching your face, cover your coughs and sneezes, clean surfaces so that you cannot catch secondary infection and avoid crowds at every cost because auditoriums, buildings, public transportation, they are all uh, potential bombs for this influenza infection. So here are some MCQs. Identify the false statement about influenza viruses A, B, and C. The correct answer is C. All three types of influenza viruses are found in humans and other animals. Second, the properties of also mixture and severity include all of the following statements, except C. The size of the virus, 150 nanometer, is larger than paramixer viruses. Which of the following is not the common symptom of the flu caused by influenza virus in man? that is rashes. Which of the following viruses gives lifelong immunity to diseases prior to infection or immunization? The correct answer is measles virus. Identify the influenza virus stereotype that causes most of epidemics. The correct answer is type A. It's very much mutagenic and causes a lot of trouble. Which of the following subjects are at risk of getting influenza? Uh, as you already know, young children less than age of 5 years old and adults who are more than age of 65 years old. The correct answer is all the above. The most common route of pathogenesis of influenza virus is airborne droplets. Which of the following viruses is most likely to cause pandemic? That is influenza A virus. Which of the following microorganism is called a co-secondary cause of pneumonia caused by influenza virus? That is Staphylococcus aureus. All of the following statements are correct about neuraminidase and hematoglutinin of influenza virus, except neuraminidase is present as a spike and is composed of a dimer. A 16-year-old girl comes in contact with a clinic with sore throat, fever, and headache. The symptoms resemble the flu-like syndrome. Which of the following primary sample specimen is collected for the laboratory diagnosis of influenza virus? That is nasopharyngeal washing. So, these are the differences from where we have collected the data. Thank you for listening to us.